feel as though that the psychological impact of this type of thing on clinicians and doctors within the hospital, takes a toll? Do you feel as though it's being underreported, or do you feel as though people kind of don't fully recognize the types of things that are going on within a hospital?
Yeah, so I mean, you're absolutely right. Most of the stuff that's coming out about COVID is patient-centered, as it should be, right? It is our job primarily to treat patients. But I think what gets lost in that shuffle a lot of the time is that we can't be our best physicians if we're not, taking care of ourselves. It's kind of that old adage, you can't take care of others before you take care of yourself. And so I think in order to find the strength and the agility, the courage to step up to this pandemic, we really do need to make sure that we are recognizing and validating all the, specific challenges and psychological burdens that the pandemic is serving us, and also start talking about the ways in which we can respond, and try and sort of curb those effects, or at least support each other as we struggle with them.
And your perspective is definitely one that's very unique as a neurology resident and as somebody who's going through this, and somebody who is obviously still learning through it, and just like everybody else, but in a different perspective. So talk to me a little bit about how the pandemic impacted your resident training, or just your resident experience overall.
I think from an education perspective, my resident experience was completely disrupted. I was literally, not a neurology resident for several months, and I was unable to, treat patients as a neurologist, to think about neurologic problems, to have time to study neurology, to attend our didactics. And of course, I'm not the only one. Everyone's sort of experience as a resident was disrupted in their own way. And that was also another kind of source of anxiety for a lot of us. Oh my gosh, one day this pandemic will end, but will I have lost a substantial portion of my training? And will I be able to be the neurologist that I wanted to be? And all that kind of stuff. And I think one thing that my program and my department did a really amazing job of was just sort of saying, you know what, we are a department, we are all in this together, we are all on the same team. We have unprecedented challenges here, and we are going to try and meet them with unprecedented solutions in the best way we can. And I think there was a lot of comfort in just, the leadership recognizing, yes, we get it. We get why you're feeling this way, and we're going to try and help you, rise to those challenges.